Hello and welcome to Health and Protection. I'm Owain Thomas, Editor of Health and Protection. Joining me today as we look through the private medical insurance market is Dr. Keith Klintworth, Managing Director of VitalityHealth.
Hello, Owen.
Hi Keith, thanks so much for joining us.
Thank you.
So to start off Keith, what do you think are the main trends impacting the PMI market at the moment?
Well, I think the key trend is the rising demand, probably as a consequence of NHS pressures, largely. Those impact on primary care services, which includes GP visits, as well as secondary care, particularly in musculoskeletal. But PMIs also broaden their product ranges, so we're offering a lot more. However, we're all experiencing quite significant increase in authorization rates, and that impacts on premium. So we've got to find smarter ways of managing downward cost, of managing supply-induced demand, and there are numerous strategies we can use to do that, but it's complex.
And how do you see this growing demand and these trends being affected through the winter months?
Well, if you use an example over the next couple of months, and particularly over the festive holiday season, it's important to state from day one is that the habit we build today has a consequence for your health tomorrow. So an example of that is nutrition. We don't eat as well over the festive season as we do the rest of the year. We don't exercise as well because it's cold and it's dark. We also drink more than what we should. So the challenge is these next 3 months going to create a habit which is going to impact on your long-term health? The winter season also impacts on loneliness and social isolation, which has a direct consequence on mental well-being. And we've just experienced on our own book that we had a 500% increase in CBT therapy consultations since 2015, which is significant. And I can't see that plateauing off soon. So we've got to be aware of those impacts on society as we go into these winter months. And linked to that is economic pressures. Heating your home, money's got to come from somewhere. And the first thing that goes is eating. So our nutritional habits change, but it also causes mental stress. And then the important asset is remember to be immunized. If there are preventative things that we can do today, such as immunization against influenza or COVID, to protect your health not only today, but for the future, you've got to do it. And then lastly, but not leastly, is the NHS pressures. And those are the pressures that we as PMI can help with. Relieve some of the burden by offering the everyday care services, which are broad and include partly GP services, physio, CBT, to name a few. But that's a role that PMI can play in our products and offerings to our members.
How is the PMI market adapting to these changes? How is it evolving to deliver sustainable care?
It's a really good question, and I think it is a challenge all insurers are facing. As the scope of product range and services that private medical insurance offers to consumers, that potentially drives up cost. But the challenge that we're all having to face is how do we keep things in the appropriate treatment centres? And what I mean by that is, we've often spoken about primary care needs to be delivered better. And the key reason for that is that, 70% of conditions should be managed in the primary care setting. Those settings are up to a third of the cost of what it would be if they were in a secondary-led consultant service. And so models are all evolving to make this sustainable, to give more offering to consumers, but you've got to manage those costs in the right centres. The second key component of sustainable healthcare delivery is really setting up networks and panels. And when I look at our creation of networks and the Premier Consultants, and I've got to be honest, the reason it was set up was to drive improved quality of outcomes. No one really believes that. They all thought I did it for cost effectiveness. No, I didn't. It was done to improve quality of outcomes, and it was to improve the patient journey. As a consequence is improved cost. And as you expand into secondary-led consultant care, which is appropriate and relevant, so you manage your premiums a lot more. And you can't just pour into this cost. It's got to be properly managed. And medical inflation is a key challenge, not least of all consumer price index inflation, but medical inflation, which is always higher.
And how does that then lead into the type of claims and outcomes that you're seeing coming through the business?
So at least 58% of our claims are now in the primary care space, which includes CBT, mental health, and physiotherapy. We then go into secondary-led consultant care, which then brings up the vast majority of our costs really driven through the hospitals. But we've been able to manage our cancer costs, I think, quite effectively over the last 10 years. It could be some positive selection, but more importantly, it's just when you're dealing with people who are on a program to get healthier, they're more in touch with their bodies and they look for things a lot earlier. So, although I can't stop breast cancer, I can't stop colon cancer, but I can influence its earlier diagnosis, and that's what we are working on. The second key thing, I think, on the whole, what's changed in the market is ownership of corporate Britain to getting its employees far more healthier than what it ever was before. But you've got to evidence you're getting your employees healthier. Is absenteeism rates down? Are they getting back to work a lot quicker? But more importantly, on activity. And, and I look at, in our corporate book in particular, people who engage in the program in the first year increase their physical activity by at least 15%, up to about 22%. However, what's really interesting is on hospitalization rates. So even just by doing 2 Vitality Active days, which probably equates to 7,500 steps a day, if they do that twice a week, their hospital admission rates reduced by 15%. If they do 5 days, hospital admission rates reduced by 29%. So how are our claims changing? Yes, we've obviously seen a lot more mental health. We've seen a lot more primary care services and a lot more musculoskeletal. Musculoskeletal, largely a result of the NHS pressures and the waiting times.
How is the health tech revolutionising the PMI market at the moment, Keith?
We all know that technology should improve the demand for healthcare. And if we cast our memories back, which weren't that long ago, to the pandemic, and how there was just this birth of healthcare providers, and particularly virtual healthcare, which really was effective in reducing GP demand into the NHS or face-to-face. But the focus we now have to really move on to is the consumer, and what does the customer need? And the challenge with technology is that it's often piecemeal or standalone, and how do we integrate it? So technology has to be embedded into operational and data structures, because that gives you that seamless customer experience as they use technology. And we just used the example in our own business of integrating virtual GP into our auth process, into onward care. And that's complex. It's not easy to do, but once you've mastered it, then everything else comes from that. The second key thing with tech is that it enables consumers to get more information so that they're empowered to make choices. And that's always been the challenge in the healthcare system, is that consumers have one version of the truth. How do they get a wider sense of the truth? Who's good? Who are the best providers? Which are the best treatment centres? How they're rated, etc., etc. And then really at the end of the day, it also makes experiences that are relevant and appropriate to the consumer. And that's where now personalisation, big data, this is a whole new world we're moving into. And how do you position your company to ensure you are using the best assets that you've got with your big data?
And that sort of then prompts a question from me is, how does that then impact patient outcomes and meet the growing demands that you're seeing as insurers?
So if you start right in the beginning again, which is about preventative healthcare, how do you personalize experiences so that I can send something that's relevant and appropriate to you, that resonates with you, to make that one change in your life to improve your healthy living years? That's far better than just a mass campaign of saying, you need to exercise, you need to lose weight, you need to manage your diabetes. So that's the real key starting point. When I then just look at my interaction with Skin Analytics, which was far back as 2015, we partnered with Skin Analytics. And at the time that I set up the JV with them, it was ensuring that your mole was, a photograph of your mole was taken, but then it was reviewed by a dermatologist. But in parallel, it was also assessed by a computer. And we built that AI tech, and Neil from Skin Analytics, that's now been the first registered digital tech that's AI driven. And the accuracy rates from AI is far higher than that of a dermatologist, mind you. But we allow both to still do it. But 60% of our members now go through the skin analytic process, having their mole seen and been told, actually, it's all fine. It's all the clear. So how does technology help healthcare demand? Well, in those type of examples, that would have gone to a dermatologist. So you've removed 60% of those consultations, which is significant. And there's so much more we can do in that space.
Thanks very much for joining us, Keith, and we'll see you next time.